This show is sponsored by the law firm of Tony Kalagarakis and Associates.
شلام عليكم. أنا ريبيكا سايمون. مجيبت يداعت شاميران قبولوخون ومشينا. همزمها وديوب دوية باسط كورونا فيروس. بتهمزمخ مخا بروفيسور ساينتست بشمت أسيا كيم مادريناس. قد إيلي خا ساينتست من Lundquist Institute. همزمتم دوية بلشانة إنجلس. Hello, my name is Rebecca Simon. On behalf of Shamiram Media, I welcome all of our viewers. Today, we will discuss coronavirus with a professor, a chief scientific officer of the Lundquist Institute, Dr. Jaaquin Madrenas, who is a professor at UCLA and a researcher, a scientist, a nephrologist, an immunologist, and an infectious disease doctor who's had over 160 publications, and currently we will be speaking to him about the coronavirus. Dr. Madrenas, thank you very much for joining us today and speaking about coronavirus.
It's my pleasure, Rebecca. Thank you for having me.
Dr. Madrenas, we've had many pandemics in the past, two of which are the 1918 Spanish flu, which claimed about 50 million lives, 675,000 of them in the United States, according to CDC data. And according to some news reports, President Donald Trump's grandfather was a victim of this Spanish flu, and he was killed by it. The other more recent flu was the N1H1 2009 pandemic flu, which claimed about 12,000 lives in the United States and 61 million people were infected. How is the coronavirus any different than these two pandemics in specific?
Yeah. Well, maybe the first thing that is different from the coronavirus pandemic, from the two pandemics that you mentioned, is that the virus that causes the disease is different. The two pandemics that you mentioned are caused by a flu virus. The virus that is causing the current COVID-19 pandemic is a coronavirus. So this is a virus that is different from the flu virus. There are two epidemics that actually are closer to what we are living now in terms of being caused by a coronavirus that your viewers probably will remember. One is the SARS epidemic at the beginning of the 2000s, and the other one, more recently, the MERS epidemic, the Middle East Respiratory Syndrome epidemic. Both of those are also caused by a coronavirus, and in fact, a similar type of coronavirus that are known as the beta coronavirus or coronaviruses. The one that is causing COVID-19, meaning coronavirus disease of 2019, is a beta coronavirus that is officially known as the SARS-CoV-2. That's the name of the virus itself.
Now, the COVID-19, the coronavirus that we're currently experiencing, has been around. The corona itself, virus, has been around for a long time, as you mentioned. How does it this different strain, how does it develop? What happens that it becomes a strain that's deadlier and more contagious? What happens?
I have to say that we know very little about what is the earliest stages by which this virus became pathogenic, so virulent, and triggered the current pandemic. Let me say that initially coronaviruses in general, and there are 6 different types of coronaviruses, have been around for a long time. And we know that they are commonly causing common cold. In fact, it is forecasted that about a third of all common colds are caused by a coronavirus. These coronaviruses live in many different animals, including cats and bats. Specifically, the beta coronaviruses, such as the one that causes COVID-19 and the one that caused SARS and MERS, live in bats. So it is possible that it's likely that the origin has to be related to a jump of the virus from what I would call a reservoir in bats to humans, probably because the virus got mutated or facilitated or had some event that facilitated its jump from the bats to the humans. And that probably is the earliest stage that triggered the pandemic.
Doctor, some people are questioning the fact that many of these viruses originate in China. Why is that? Mm-hmm.
Well, that's an interesting question, not only applicable to the coronaviruses, but to the flu. Probably because of their natural reservoir and the fact that in China and in the Southeast Asia, there are close proximity between different types of farming, poultry, for example, and porcine farming take place closely. And these are common reservoirs for viruses. Same would apply for some of the avian viruses that can cause actually flu-like diseases. So in other words, you see that the natural reservoir of those viruses is able to jump, or it changes from the animal that is the reservoir to a close species that then can transmit it to humans.
Do you believe that the World Health Organization or a conglomerate of countries in the world should really advise China or request China to do something about this? Because this affects all of us, the way things either naturally happen or by design in China.
Certainly, this is a good point to bring up. I think that under the current globalization, it is important to keep that very specific changes in lifestyle will have global impact, and this would be one of them, no doubt. In today's age, with the rapidity in which people can travel across the globe, what we are seeing is a very easy expansion of infectious diseases that otherwise would be local. So I think that trying to intervene or recommend strongly that some lifestyles that may favor viral mutation and viral transmission, it's certainly something that would have a very positive impact. Having said that, I think that we have seen the Chinese government, in terms of public health and in terms of strategies to contain the epidemic, being very successful. China actually could be said that at this time is certainly back to what could be the basal level of infection. So they have contained the infection, and right now they are returning back to normal, if I may say so. And their major concern now is not to get new cases from outside China.
Yes, we do hear news that China's cases are tapering off, which is really good news for the rest of us. Of course, the other countries are not experiencing the same thing. We probably
No.
because are at a later stage of this. I mean, China has already been at this for some time before we did.
Yeah,
Doctor,
correct. So China had 82,000 cases. Was checking to the last update from the WHO. The actual reporting of the cases started about January 22nd, although we knew that there were already quite a few cases starting to pop up in China, in the Wuhan region. And so we know that by end of February, beginning of March, they were really on their back to baseline levels. So they had to actually contain the epidemic. And I think that this has been the case until yesterday. That is the last day for which I have data. I think that similar claims can be made for the Republic of Korea, for Korea. I think that Korea has also been very successful in containment of the epidemic. In fact, the Republic of Korea had 8,300 cases, and that were primarily reported in the period between February 18 and with a peak of around the end of February, beginning of March, and now they are back to almost baseline. So Korea is another country that has been able to handle the epidemic very successfully through very open and aggressive measures of containment, and with the engagement and involvement of the population at large. Now, in contrast to these two countries, we are seeing different dynamics right now in the Western Hemisphere, primarily in Europe and in the US. And in Europe, perhaps the epicenter is Italy, in which we are seeing a spiral of cases. Currently in Italy, there are about close to 28,000 cases. And what is alarming about the case in Italy is that the mortality of COVID-19 is higher than what we are seeing in the majority of other places. The mortality of COVID-19 oscillates between 3 and 4%. And in Italy, according to the last numbers I have, the mortality would be around 6.8%. Different
double.
Factors can play in that. Yeah. It could be that, again, there is an issue of affecting an older population that we know is a risk factor for negative outcomes of the infection. And certainly, it may also be that it took a while to really come up with stringent measures of containment. I want to be optimistic also in saying that in countries in which there has been implementation of these strategies of containment, we seem to be looking at a stabilization of the number of cases, new cases, or actually starting to come down. And we see this in some Scandinavian countries, for example, in which there is an stabilization of new cases or starting to come down.
Mm-hmm. Dr. Madrenas, what are the symptoms of this flu? If people may have a common cold, they may confuse it with corona. What are the classic symptoms of the coronavirus?
Yeah, so I think that this is an area that we are very closely learning about. Based on the experience in China, in Southeast Asia, and now what we are seeing in patients in Europe and here in the US. Most likely, the majority of people that get infected do have a rather no symptoms or a mild case of common cold. Primarily with cough and fever. These are the two consistent symptoms that are reported in these patients. Now, this is with regards to the overall population. Now, what we know is that the disease becomes more severe in individuals that are older than 60, and also in individuals that have underlying conditions, primarily hypertension and cardiovascular diseases, as well as diabetes or immunosuppression for any other reason. On the other hand, younger populations, and in particular children, seem to be less prone to develop a severe disease. They basically have a very mild disease if they show any symptoms, and the outcome certainly is consistently positive recovery. While in people older than 60 and with underlying conditions, the mortality is significantly higher, reaching in some statistics close to 20%. So we are seeing a completely different profile of manifestation of the disease depending on the age of the person, as well as any presence of concomitant diseases, primarily in the field of cardiovascular diseases.
Do we know why children are not getting this specific virus? Is there, do we know, or are we going to study it?
Yeah, we don't know. We don't know why children would be, let's say, more resistant to the virus itself. So there may be some hints that we are learning as we study more and more the biology of the virus in question. There may be an explanation for why individuals that are 60 and older, and those with diseases, cardiovascular diseases in particular, may be more susceptible to serious disease. And that is, we know that the virus uses a receptor on our bodies called the ACE2 receptor. And this is a receptor that normally could regulates the blood pressure, and what it may happen is that individuals that are older than 60 have a certain degree of cardiovascular disease. The expression of this receptor may be higher, perhaps maybe because even medication that these individuals take to control the blood pressure. And as a result, the virus has more chances to get into the cells and therefore cause disease. This receptor, by the way, is expressed in many organs within our body. So as you can imagine, once the virus gets into the body, it can go into many different tissues and organs and cause disease. What we see in these extreme cases of disease is that the virus causes significant lung respiratory disease. These patients go into respiratory distress and may require ventilation in order to go through the period of infection.
Doctor, we have been so far short on testing kits. How do we know what the true number of infected individuals are if we have not been able to properly test people?
That is true. So we are currently having to deal with the fact that it was not possible to test as much as possible. And the other thing is that it was not possible in some cases to actually document the progression of the test during the progression of the disease. In other words, once one patient is identified as being positive for the coronavirus, to see whether he or she becomes negative and at what point it becomes negative. The numbers I'm giving you are numbers of documented cases. Again, it is likely that there will be a very significant pool in the population that may be carriers of the virus in a completely asymptomatic way. So they carry the virus, but they do not feel sick. So in those cases, we, except if we were to go and have unlimited tests to do, and we proactively were looking for positive carriers, we wouldn't find them. Now, in patients that show symptoms of the disease, that is where I think the effort is now to provide sufficient tests in the population so that we can document with more accuracy what's the true degree of spreading of the pandemic.
Now, of those people who are infected and go through the process of getting sick, a vast majority of them recover. Do they
Correct.
fully recover, or will they have some impact on their health from this virus?
This is also a very interesting question for which we do not have complete definitive answer yet. I think we should have it, but as of today, we don't. Let me give you a little bit of background on how to tackle that question. So we know that once an individual is exposed to the virus and gets infected by the virus, these coronaviruses in general stay in the body between 3 and 6 days before they show or they cause disease. This is what is known a period of incubation. Okay, for the virus causing COVID-19, we think that in the majority of cases, the period of incubation will be around 3 to 6 days. On average, let's say 5 to 6 days, okay? Now, what we know, though, is that in some patients that have had COVID-19, the period of incubation can be as long as 14 days. That's the origin of why 14 days are considered to be the period you need to be in isolation before the symptoms, being free of symptoms, right? Because in COVID-19 patients, we see that that period of incubation at most is 14 days. So during this period of incubation, and what is remarkable for this virus too, somehow, is that the patient may be already contagious, even though it doesn't show symptoms. So a person has been infected, but is still not showing symptoms. It's in a period of incubation, but it can actually be contagious. Now, this is one thing to keep in mind. That's why testing would have some effect in characterizing the dynamics of the pandemic in a more accurate way. Now, the other thing that is starting to come up in the series that have been described, series of COVID-19 that have been described, is that even after recovering from the disease, patients may still be contagious. In other words, may still pass the disease, okay? That is also an area of concern. They recover, but for a few days, they seem to be able to still pass on the disease. And then this has to be corroborated in other series. The currently is only applicable to a series that that was reported from China, from healthcare workers in China. So, so with these two things in mind, the question is whether after recovery of the COVID-19, people will be completely healthy or not. I cannot tell you yet. I don't think that we have gone through sufficient follow-up of patients as to answer this question in a robust way or in a verifiable way yet. Based on the experience with other coronaviruses causing common cold, I would expect that may be the case in the majority of individuals, but I cannot say for sure that this is the case.
So we will be studying this way after it's gone from our memories. We will still be studying it.
I think that it's going to be a case study in many different fronts, not only because of the biology of the virus, not only because of the medicine associated to the response, the physiological response or their biological response to the virus, but also from a public health perspective and the epidemiology perspective, and how to really come up to ways in which these type of health emergencies can be handled. In addition, and as we are seeing more and more, this is not just a medical emergency. We are starting to see effects on other aspects of life. The markets are a reflection of it, but even the regular social day-to-day life of the population at large. And all these will be very interesting to study and to assess for future occurrences.
Sometimes we never get a chance to meet our clients. Wrongful death is not easy for the family. At the Injury Lawyers of Illinois, we focus on what we do best, car and truck accidents. We're very selective with the cases we take on. We understand and approach every case as if it's the only case in the office. We spend so much time on a given file that we relate to that particular client. The ultimate goal is to make the client whole, is to put that client in the same position as they were prior to the accident ever happening. A client has to understand where their case stands. We speak their language. We have individuals in our firm that are fluent in 8 different languages. The client is aware with regards to what's going on in their case at every level. A lot of people out there don't realize that the big insurance companies are not primarily focused on their treatment, their health. We are. After all, it's the client's interests that we have in mind. We know how to start a case, and we know how to end a case with a successful resolution. We have the resources, we have the knowledge, we're local. We've handled thousands of cases regarding car and truck accidents. That's what we do. My name is Tony Kaligarakis, and I'm the managing attorney at the Injury Lawyers of Illinois.
Now, doctor, how is this transmitted? Let's say we go back to normal life. We gather with friends and we go to restaurants and public places and theaters. How is this virus transmitted? Is it just basically being around the person or any other closer contact?
Yeah. So yes, that is a very important question. The transmission of coronaviruses, and in this particular case, it seems no different, is primarily through droplets. In other words, as we speak, or as we cough, or as we sneeze, there are droplets coming from our upper respiratory tract, and those droplets will contain the virus. Those droplets, on average, can fall within 6 feet of the person that is emitting them.
As we speak?
So
it drops, it travels example, 6 feet?
You can imagine there is always some emission of droplets during conversations, some individuals more than others, right? In those cases, probably the range is very, very small. It would not be 6 feet, right? But still, you could see these. The ones that are more concerning are those associated with disease. In other words, coughing and sneezing, because those are not only a reflection of respiratory irritation, but also the ones that would come up with more force and therefore can reach up to 6 feet. That's the reason why 6 feet is the distance that is recommended between individuals when interacting at this time to prevent, being exposed to these droplets. Now, once the virus falls, in these droplets, the majority of studies point to a survival of the virus between 4 and 6 hours. But the virus can also survive on surfaces for longer. And in some cases, there has been reports that it can survive even up to 48 hours. So that is another aspect to consider. There may be, this virus may actually be able to survive on some surfaces like bench tops, tabletops, for longer period of time. And that's why it's so important that people take precautions in terms of cleaning areas in which droplets may have fall, or more importantly, people try to prevent the emission of droplets by coughing on their sleeves or always covering the mouth and nose when actually coughing or sneezing. That is also the reason why we are looking at protective equipment for individuals that may be having to be exposed to patients, because the transmission is primarily by the upper respiratory tract of these droplets. Now, or virus in these droplets. Now, the other thing is that because of this ability of the virus to survive on surfaces, it's also very important that people wash their hands very thoroughly, for 20 seconds with soap and water. That will get rid of the virus. And to even be safer, what is important is that people don't touch their face, because that would be another way in which viruses that could have been touched by hands of an individual may end up into the nose and therefore have an entry point towards the respiratory tract.
So you
now,
may
it is important altogether. What I'm saying is it is important to really implement measures of containment, and those include, drop the emission of droplets by coughing on the sleeve, by making sure that the mouth is covered when sneezing or coughing, and making sure also that people wash his or her hands and practice the social distancing of 6 feet to minimize the chances of exposure to the virus.
You may want to sarcastically say that this virus is a very healthy and vital virus. It doesn't die so quickly.
Yeah, indeed.
Doctor, a lot of times we go to places and we see some people with the disposable medical masks on their faces. So that really works in containing the virus and not spreading it by not allowing the droplets to get out? Or do they go beyond the mask?
Okay. So let me tell you about the mask. The mask, certainly, there are 2 types of mask, what we call the surgical mask. Just to give you an idea, it would be the classical mask that surgeons, for example, use during operations in the operating room. And then there are what they're called respirator masks, or the N95. These are the most effective mask for this type of situation. They are the ones that really are tight on the face of the individual. Now, the surgical masks are very good at stopping the emission of droplets outside. The respirator, the N95 mask, are good at basically protecting from emissions or from exposure to viruses that are or to other particulate matter that are in the environment. So where there be a campaign requiring this type of protecting equipment that so far is not required for the general population, I think would be more along the lines of the respirators, preventing outside particulate matter going in. Okay. Now, I have to say, though, that the social responsibility starts way before having to wear masks, that we are not in that situation yet. By that I mean it's important that people try to minimize social interactions at this time, try to avoid large gatherings, practice social distance or social distancing, try to telecommute as much as possible. And all these will actually minimize the chances of transmission. And by doing so, I think we should see an effect, at least within the next 2 to 4 weeks. And remember, that is because we need to consider that in the next week to up to 2 weeks, what we are going to see is new cases that are coming from infection in the last day or so, right? Or in the last week, because of the period of incubation. It's only after these 2 weeks that we, of practicing these social containment measures, that we will see an effect. And that's why I think that it's important for the general population to really be committed to practice these recommendations, because it's not as important to basically not get the disease oneself, but actually is as important not to pass the disease to someone else. So those measures actually balance both or tackle both actions.
Doctor, what has the world learned from this pandemic, which has been a little more, we have been a little more cautious and vigilant in containment. But what has the world learned about the future pandemics that may be coming our way? And how can we get ahead of these? Are there any policies we should institute or any practices that we need to be mindful of at this time before the pandemics arrive?
So this is a very open-ended question that could probably take a long time to examine and answer properly. I think I can give a few hints of what I think we should learn from this situation. One is perhaps that in this day and age of globalization, infectious diseases may become a global problem very fast. And the response to them should not be to ignore them, but actually to proactively tackle them at source. Think about traveling, people getting into planes. Planes are now like the ventilators that pump out, an infectious agent. Why? Because anyone can get into a plane with a disease in point A and land in point B very far away and transmit the disease there away from the source. So I think that, and in the context of globalization, it's important that there is, responsibility put on coordination of responses that act expeditiously on the containment of the spreading. I think that these measures, although not as attractive as it could be the development of new vaccines or new drugs, certainly continue to be important in the control of an epidemic. The second thing that I believe we are going to learn is that it is possible to work in a global concerted effort in tackling infectious diseases. What we are seeing is with a very fast turnaround, we are looking at the development of vaccines, working in many different levels, in many different countries, and in a collaborative way across laboratories. Now, development of vaccines takes time. Remember, it's not only the actual science associated to the development itself, but also they have to be tested and confirmed that they are safe and effective. The same could be said about the ability to develop diagnostic kits very rapidly. This is something that we are seeing. These kits or these diagnostic methods have been developed in the last couple of months. I think that this is to the credit of the investigators that are working in this area all over the world. And the third thing that I think it's something that we are learning, and I think that we positively need to enforce, is the ability to come up with the drug development that may help us to treat the disease. In this case, we know that there are several clinical trials already going on to test different drugs to treat COVID-19 in China and in Europe. So I think that these three aspects of the epidemic, the development of vaccines, the development of diagnostic tools, and the development and testing of drugs that to treat the disease, will be something that more and more will be the norm of the day under conditions of infectious disease caused health emergencies. Now, last but not least, I think public policy certainly needs to be involved. Politicians ultimately do have a responsibility to the public, and I think that they need to be educated on these, as well as they need to communicate effectively and timely about the situation and the strategies that are put in place to contain that situation.
What are the scientific parameters that the scientific community can say COVID-19 is now under control and the worst is over? What should happen before the scientific community can decide on that?
Well, so I think that the official or the academic way to answer that question is that we should be witnessing a consistent decrease of new cases to a return to zero cases, ideally. And then, because of the period of incubation, even though in the majority of cases is about 5 to 6 days, but since we have seen these for 14 days in some cases, I think that the official or the academic way to define a return to normality would be 2 periods of incubation or 28 days without no new case reported. That would officially put an end or allow to call a return to normality. This is a standard way to define the end of an epidemic. 2 periods of incubation without new cases would be a way to do it. I have to say, before that, as we look at the number of new cases being reported, one can already see in those countries that have gone over the peak a consistent decrease of the number of new cases. We saw it in China, we saw it in Korea, we are starting to see in some countries, very few yet, while in all others, including in the US, we are still in what is called the exponential part of the curve. In other words, that the new cases are increasing dramatically. Now, we have to keep in mind that this is a coronavirus, and as such, one needs to be conscious that with the arrival of the fall, there may be a presence for coronaviruses causing diseases or cause diseases. And it is possible, it's not clear yet, that this coronavirus actually could be seen again in the fall, although hopefully in that situation, there may be as any other common cold. We don't know yet. So at this stage, I think that we are concentrated on the pandemic and making sure that we put an end to this pandemic as soon as possible.
Dr. Madrenas, is Lundquist Institute involved in developing a vaccine for COVID-19? And are you involved in any kind of research for that? You personally?
No. The Lundquist nor myself are not involved directly in the development of a vaccine against the coronavirus that causes COVID-19. We do not work in this area.
Doctor, my last question to you is, if you were to give President Donald Trump and his administration one advice on what they should have done or what they should do now or in the future, what would that be? Your personal opinion.
Yeah, I would summarize it in a very simple statement. I would ask the president to please pay attention and listen to the experts that are, ready to provide him with advice. I think that it's become clear that Dr. Fauci, as director of the National Institute of Allergy and Infectious Diseases of the National Institutes of Health, certainly is at the forefront of virology and infectious diseases, and I think his advice is essential for Mr. Trump to follow.
Thank you very much, Dr. Madrenas. Your wise statements and your intelligence and your years of experience has been touched and is, as I am certain, many Assyrians, the Christians of Middle East around the world have listened to you and have learned from you as to containment and the nature of this virus. I thank you very much for your time. I thank the Lundquist Institute for coordinating this interview. Best wishes to you.
Thank you very much. It's been my pleasure. Thank you.
Thank you. مغبن آتورای إلخا فيروس قد سامزودة ناشبشنة ومرانة بدواقونة اتلهيفي قد شميتون الإكسبرت موينة مارا وديتون له أومندية لازمي له قد آمر لا باريس و ناشخين لا دوقي من كل اللي بي كل انتوخون هيفية سلاماتي تابتن بس سيمرا